Hello, everybody, and thank you very much for joining us for this webinar hosted by RingCentral and SINC USA. My name is Jason Senemore, the Chief Product Officer at SINC USA, and I'm delighted and honored to be joined by a panel of IT leaders for candid discussion and senior executive perspective on what it really takes to enable employees for remote work. Remote work has quickly gone from what some saw as a trend to a necessity. And the speed of this shift has placed both companies and employees in a challenging position. During this discussion, we will cover a number of sections, including the challenges and solutions for rapidly enabling employees for remote work from home, addressing the new IT requirements for a distributed mobile workforce, empowering employees with effective combined communication and collaboration tools, balancing short-term and long-term work from home strategies, and keeping remote employees engaged and effective. Joining me today is Paul Chabot, the CIO from Clean Slate Centers. We have Sarah Tripp, CIO for the Behavioral Health Administration of the State of Washington. Diane Jurgens, the former CTO and CIO of BHP. And Amir Hamid, the VP of Global Solutions Engineering at RingCentral. So let's jump right in here, guys, and start really with the key topic right now, which is obviously the pandemic. COVID-19 came on rapidly and really changed our way of working overnight. To begin with, and to do a little bit of a round of the speakers, I'd really love to just get a very open and honest understanding of how prepared you and your organizations were. So Amir, I'm going to come to you first for the benefit of the attendees. If you can just reintroduce yourself and then let us know, obviously working for an organization that offers tools that allows companies to have successful remote work strategies. How prepared were your organization in this space?
Yeah, thank you, Jason. So again, Amir Hamid, I'm the Vice President of Global Solutions Engineering with RingCentral. I live in Toronto, Canada, and quite honestly, certainly a surprise, but from a preparedness perspective, I think we were pretty good. So in my particular role and with my team, we actually travel. We visit customers. In my case, I've got a global role. So when I'm not traveling, I'm often in my office. And so I've got the tools through RingCentral that allow me to message, video, and phone all on the device of my choice. So obviously when I'm traveling, it happens to be my mobile. When I'm back at my office, it happens to be my desktop. So I think, from that readiness, certainly all of the field teams were fully enabled, aware. That being said, a lot of the back offices, because obviously all of the offices are closed now. So our IT teams did a tremendous job in extending out those tools to all of the other teams which were not necessarily used to working from home.
Fantastic, thank you very much. Diane, you have actually been through an entire project, 3 years, I believe, to create a successful remote work strategy at BHP. So talk to me a little bit about your preparedness for this situation. I'm sure a little bit more prepared than some others.
Thanks, Jason, and thanks to the RingCentral team for sponsoring this. So I'm Diane Jurgens. I work for BHP, most recently Chief Technology Officer. So for those of you who don't know BHP, we're the largest resource company in Australia, headquartered in Melbourne, previously living in Singapore. And when you think about remote working, we have resources, huge mines, huge petroleum resources, and having people on site, fly in, fly out, thousands of kilometers from major cities is a big challenge for us. And so we've really been working for the past 3 years to relocate as much work as we can to larger cities. It creates a better workforce, a better lifestyle, and allows us to get a much more diverse number of people into our company. So we have been working in this environment for the last 3 years to not just move text and video and conversations, but the operations of equipment, railroad, port, major operations into remote operating centers. But of course, during the recent challenges, we have to have people still go to site, but we have really changed the protocol of how to do that safely. So the communication tools like we're using today are really, really important for us to keep our workforce connected in a really different and challenging environment.
Fantastic, thank you very much. Sarah, you have psychiatric hospitals and other locations where individuals are involuntarily committed. Talk us through some of the direction you received once everything started happening.
Yeah, this was a huge change of perspective for us, because I don't believe that the executives at the psychiatric hospitals, we have 3, don't believe they even thought of the workforce ever being remote. I mean, healthcare is hands-on in most cases, but when we looked at it and said, okay, what are all the roles that could be remote? They said, quick, get them out. So my boss, the assistant secretary for DSHS, said, anybody who can work remote, the role, get them out. So our IT team had to enable that, which meant ordering 400 laptops that hadn't been planned, and discovering in that process that everybody else around the country was also ordering. And so huge backlog on that. And then people were sent home even without devices. And we did Citrix and VPN, all of those had to be increased. But as we've gotten laptops to folks, that was the first wave. And then it became, well, communications, how do we do print? How do we do things like electronic signature? I mean, there are a lot of things that my state agency did not have appropriate policies on. So it's a big shift from the way we were doing business.
Yes, yeah, big is a bit of an understatement. Well, thank you very much for that. And Paul, I understand that you've actually worked remote for some time, but as an organization, Clean Slate obviously must have gone through some fundamental changes there. So talk to me about how prepared you guys were, and I suppose how that has developed to this date.
Yeah, thanks. So again, Paul Chabot, I'm the CIO for Clean Slate Centers, and we are a national organization supporting those with substance use disorder, more specifically opioid use disorder. So it's outpatient centers that we have, about 80 centers across the country. And as Sarah kind of mentioned, you know, the healthcare up until a month or so ago, right? It was very hands-on. Patients come into our centers to meet with physicians, meet with therapists, behavioral health individuals, as well as do labs, urine and blood screens. So it's very much a come into the center kind of a business and therapy, if you will. And everything changed dramatically a month or so ago. Were we prepared? So technically, we were prepared from the aspect that we were lucky enough that many of our tools were already hosted, right? So you're using, you know, the Office 365 and everything is hosted there. Most of our EMRs, they're all hosted, so clinical tools are hosted, which was excellent. It was very easy to just tell people go from home and you can access these tools. We've got secure logins and those sorts of things. What became problematic for us actually was the phone system. We have a call center, and we're using more of a legacy type call center software that's really not designed for work at home. You know, Sarah mentioned ordering 400 laptops. Well, we weren't prepared to do that. We had people taking PCs home and taking their Cisco phones home. And then when you get to that scenario, you have to make sure that they're connected to a VPN with a certain IP address, which is very difficult because everybody's home modem and possibly router has their own networks and subnetworks and all those sorts of things. So that was the biggest struggle for us, honestly, was telecommunication, which is driving us to really look for more of a hosted, you know, voice over IP system as it integrates with texting, because now our patients aren't coming into the office, they're doing telemedicine. So it's how do you call them? How do you text them? How do you, if you're using Zoom, how do you get them the Zoom number for their upcoming telemedicine visit? So that communication piece, I think, was the really big difference that, or situation that we didn't prepare for, was the communications. Staff jumped up very quickly and was able to figure out how to do telemedicine, how to operate from home as an individual who works in the center. Now they work from home. And even the patients at home was fine, but the communication was very difficult in a quick fashion to get it right.
Gotcha. Fantastic. So I suppose out of that as well, you mentioned a few roadblocks. What other kind of key roadblocks have you experienced in all of this?
I'm sorry, was that to me?
Yes, sorry, coming back to you. Little follow-up question.
So other key roadblocks that we have, well, getting the patients to understand how to use this technology. So the predominant patient for us is Medicaid. They have potentially an Obama-given healthcare phone. They're called the Obama phones, right? So the government has given these phones some years ago. So then it was the debate of, do they have data on their cell phones to be able to do a video stream that doesn't run them out, run their data short before the end of the month, access to Wi-Fi and broadband, and then just the patients being able to manage using a cell phone to do the visits. So we are temporarily right now using Zoom. So they have to learn how to use that software. And now you think about, there's no help desk for the patients. You know, as an IT organization, we think about supporting our 800 staff, but then you realize we've got 20,000 patients out there that are calling in every day, and they don't necessarily know how to use Zoom. And we unfortunately had to try to arm providers and our centers with the training materials for that. But that's not normally their job, to be doing, you know, technology training. So that kind of cultural or technical shift was really big on our patient base.
Yeah, Jason, I'd like to add to what Paul said, because my patients don't leave the hospitals, but what we learned with COVID, we had put in telepresence in multiple sites at all of our locations, but they weren't on the ward. And these were for forensic evaluation. So a number of our patients are there for either a competency evaluation or restoration. Guess what? When COVID hits a hospital, you don't want your patients traveling ward or across the campus to get to another location. So all of a sudden that changed, because the patients are basically stuck in their ward. And so all of a sudden we had to deploy extra devices for the patients in their wards. And also in our children's psychiatric hospital, cutting off visitation in all the hospitals was hard, but the last one we cut off was a child study and treatment center. And so connecting with those parents and families, because we have children from age 5 to 17. So they need a high quality of video connection. And that was one of the things we really had to step up on that was not anticipated.
Wow, yeah, I can imagine. Quite the task to undertake. Amir, coming back to you, obviously, in your role there at RingCentral, working with a lot of IT leaders in terms of helping them implement, you know, work from home strategies and getting the tools up and running, et cetera, et cetera. We'd love to understand and really know some of the surprises you've seen, both positive and negative, from the sudden and drastic shift to almost 100% working from home.
Absolutely, yeah. So let me do it in the context of healthcare, given the two esteemed panelists brought that up. So we do have a customer, Pacific Dental. You guys may be familiar with them in the Seattle area as well. Now, they've got 800 practices across the U.S. They're growing at about 100 practices a year, and they went on this mission to kind of figure out, you know, how am I going to rejuvenate my existing practices, at the same time getting the new ones up to speed and getting people to collaborate better. So what they did is they ultimately, after extensive search, they selected RingCentral. And what we were able to do is, by delivering our cloud-based platform to them, they now have the ability, with contact center in the cloud as well. It's all integrated. So you've got the messaging, you've got the voice, you've got the phone. And so you heard earlier, you guys talked a little bit about, various video conferencing or messaging or other tools. I think at RingCentral, we've got a holistic approach where we bring it together. And what they saw is, a dental practitioner in California could actually consult with somebody in Ohio and share. And so that had already started. Now with COVID coming on, they extended it out to a telehealth scenario. So now, because obviously it's very dangerous, people are not going out, people are not going to wait in line, they now have the ability to service their patients, if they've got extreme dental pain, through video collaboration over the platform, where they can actually remotely diagnose and then determine, does this patient actually need to come in for further help or not? So this is just one example, a kind of a surprise, if you will, by kind of leading that digital transformation into the cloud for one purpose, but then having the readiness to extend that out, to patients, which was not the original intent, but certainly worked out well. On the negative side, coming back to myself, I'm a people person. I love meeting people and traveling, and certainly that's come to a halt. At the same time, I'm reconnecting with my family. So my family's getting a lot more of daddy than they're used to.
Fantastic. Thank you so much. Moving kind of away from COVID a little bit now, and Diane, I'd like to come to you with the first question as we start looking more around, planning and success strategies. Somebody who's obviously gone through this journey, what are the most critical business and technology components to make remote work successful for all types of workers? Oh, sorry, Diane, if you just stop, you're unmute. If you can just unmute yourself.
Yeah.
There you go.
Thanks, Jason. I generally look at it in three kind of overlapping circles, and I do this anytime I'm looking at technology. One is the technology ready? But the other two are extremely critical. You often have legal and regulatory environments that you need to operate in, and then whether or not people will accept the technology and how they adapt to it. The analogy I'd make is in self-driving cars. So I come from the automotive industry. We have lots of technology that can help us do self-driving cars, but often constrained by legal and regulatory. And then do you really want to drive with your hands off the wheel? So these three circles and balancing driving technology forward and making sure we have solutions, along with, are you doing data privacy, security? You need to open things up, but are you still protecting? And then how do people adapt to the new ways of working? And how do we make that more seamless for them? Technology in this case was probably the easiest. We had to expand for growth. So it's looking at service levels, opening up more bandwidth. And the mechanics of that are fairly straightforward. But getting somebody to, as Amit said, feel comfortable interacting in this kind of environment where they've used to be face-to-face. So I think it's balancing all three and making sure that we've covered the legal side, covered the people side, and then do our job every day on the service levels and the capacity and the quality of the technology.
Excellent. Sarah, one of the areas that a lot of folks who sometimes push back on the idea of, remote working, et cetera, is employee engagement and productivity. In your personal opinion, as a CIO and an IT leader, how do you keep remote employees engaged and remaining effective?
Well, one of the things I've done is I have the list of all the IT employees across the state for 3 hospitals, special commitment center, headquarters. And when I'm between meetings, I seem to spend all my time on the phone these days. When I'm between any phone meetings, I'm calling and reaching out to help desk techs, network admins. It doesn't really matter the role. And even though they all know me, they don't report directly to me. There's kind of layers of management. And the very first thing I do is ask how they're doing personally and their families. And that has been a big win. Then after that, then they talk to me about how they're doing work-wise. But we have the challenge of, we've had 1 patient die at our largest hospital. And last week, unfortunately, we had a nurse die at our at our second largest hospital. And so that affects people. I mean, there's fear, and they care about their coworkers who are still at work. So some of it is really not technical. It's really pulling out your management skills and taking care of the people side. I don't spend my time on technical issues right now. The CTO and my deputy CIO, I'm on the phone every day, multiple times with them. And some of that is just kind of keeping them afloat or being their sounding board. So it's a shift. I'm not strategizing about technology. I'm really strategizing and reaching out, how do we touch people? And then I'm sending out kind of a Friday thoughts email to everyone and just pointing out the value of what they're doing.
Yes, Sarah, I think you're absolutely right on. At RingCentral now, we've really moved to a video-first culture, and so leveraging the tools, finding out who's available. We're constantly on video, and it's allowed us to get a lot closer with our employees, with my teams, because now that everybody's working from home all the time, in many cases the kids are home from school and spouses, so we get a lot of interruptions. And you know what? That's okay. It's okay. I'm learning so much more about the team and their people and their personal lives, and I find that that's it's allowed us to come together. And typically on Fridays, we'll do virtual happy hours. We're not talking any work. Let's all have a drink or just get together and cheer each other up. So I found it's actually brought people closer together in these difficult times.
Definitely. I couldn't agree more. And Amir, staying with you here, lots of companies have invested in separate communication tools for calls, meetings, chats, various things. Now, your opinion, does juggling and switching between separate tools create additional productivity issues for remote workers or, IT in general?
Yeah, so I think the benefit of having an integrated platform like RingCentral is, whether it's messaging, calling, or phone or video, it's all in one platform. And the benefits there are, from an analysis perspective, when you look at some of our analytic tools that RingCentral it provides customers, exactly who called, the duration of the call, when I'm calling, if I'm calling or video calling, I've got context, I've got teams made up within my messaging tool, so that from within there, I've got all the context, and then I can go to a video conference. So everything is together. So all of the communications we have are done with proper context. And I think there's a huge productivity gain when you don't have a separate video conferencing tool, a separate tool for messaging, and then calling, where it's kind of fragmented. There's huge benefit of having it all together. And I think that's part of the value of shifting to the cloud, quite frankly, as our businesses across different verticals move towards digital transformation. That's the true benefit that a company like RingCentral can bring to the table. It's seamlessly allowing that. I'll give you an example. I'm on video calls all day long now, quite frankly, and sometimes you need a break. I have the ability now that literally with one push on a device, I can shift to my mobile and still keep that video conference continuity. And I can go to my kitchen, or if I needed to step out for a lengthy call, I've actually done that, where I've actually gone out and run an errand, come back, so I'm on the cellular, on my cell, on a cellular network. I come into the home office, shifts to Wi-Fi, come back to my desktop, and with one button on the RingCentral platform, I'm able to continue that video conference call. And again, end-to-end context, I haven't missed anything. So I do believe that customers are seeing the benefit of having all of it in one platform.
Amir, this is Diane. I'm just curious. We talked before everyone joined about the integration of your tools and other platforms. And, frankly, I hadn't heard about RingCentral until this call, so it was really educational. But as you're moving around in that example you just said, are there any concerns about privacy, security, that how do you get your employees to manage appropriately their behaviors when they're walking around with a business call in the store on their phone?
Absolutely. So, security and, other compliance that we talked earlier, things like HIPAA, we would not have been able to service Pacific Dental the way we did if we didn't, adhere to HIPAA. We've got FINRA, we've got high trust. So whether it's from security or compliance, all of that's got to be built in, no question. But it also comes back to training, right? So you've got the tools, you've got the people themselves, the subject matter experts in this case, but you've also got to have processes that come hand in hand. So you have to have that understanding that, hey, I'm in my home office right now, and the door is shut. People may pop in here and there, but if I was doing something that's confidential, then I'm going to put up a sign and say, hey, you know what, nobody disturb me right now, because we're actually perhaps transacting business where there's some more confidential nature of discussions happening. So I do believe there is a little bit of a processes and a training component, to your point, to ensure people understand that although you're not working at work, you're still working, and you have to adhere to all of those, enterprise grade privacy, confidentiality, security. None of that can drop. So that's a great point.
Yeah, I think you're absolutely right, Amir. And sort of one of the tenets of HIPAA, right? The processes are just as important as the technology. People have to be following, certain rules, because certainly anybody could do something non-compliant that's outside of technology, like using your phone and take a picture of the screen as an example. Something that I think you had said too hit me with training. For us at Clean Slate, one of the more difficult things, I kind of mentioned it for patients, was how do we get the training out there so fast to people on how to use some of the new tools? So if you're suddenly working from home, and where are you going to use Teams for internal communications, that was a big change very quickly. And some folks, jump on it very quickly. Others still stick to email. And you quickly see factions no longer using email anymore. And so you kind of, the whole fear of missing out, right? In a corporate or company environment, if you don't train people quick enough to get onto those new technologies, folks can be left behind, literally, from a communication standpoint. So I would agree that wrapping that all around into something that is integrated, all those different channels, is really important, because it's different strokes for different folks, right, in terms of what they want to see. And anything that can make it more combined under one system like a RingCentral, I think it's going to be a benefit, certainly, because if you have too many, you can't keep up with all the different channels.
It's just harder to keep up, Paul. Totally agree. And the other part of it is trying to have successful adoption, right? So when we work with clients, we work with customers, we work very closely with the IT teams to kind of identify certain, let's call them more influential folks. Let's maybe get them on the trial or the proof of concepts, kind of get them using the tools and realizing the benefits. And then at the water cooler, you're like, hey, this thing's really cool. And when you hear it from them, more people are trying it. And then that, and of course, from our perspective, we've got all kinds of training, webinars, training sessions, things of that nature, to ensure that the business maximizes the full potential and gets the absolute maximum outcomes that they need from the investment they've made in shifting towards cloud-based communication. So totally agree with you.
I think the other important part, though, is you need to learn to prepare in advance for meetings. Like just when I had to download a package this morning, my mom called me. I'm her IT support, by the way. And she had a doctor's visit and they told her to log into a virtual room. Well, she didn't know how to download the app. So we just need to prepare that there's extra time and training and different tools. And there's so many out there to learn how and be prepared is a challenge, I think.
Diane, I almost feel like we talked in advance, because we just introduced our RingCentral video, which is one touch. So there's absolutely no downloads. It's WebRTC based, and it's integrated with our phone and with our with our phone, with our video. It brings in the video and the messaging as well. So now we have the ability, so if it was your mother or somebody's grandmother and they were invited to a meeting, they simply hit one button and their browser will turn up leveraging WebRTC, and we're having that conversation. So rest assured, companies like RingCentral are thinking, how can we further simplify and make it even easier so that folks don't need to do exactly as you're describing.
Great. Thanks, guys. So as we start to round off the conversation here, I do want to shift towards, long-term goals as well, right? One thing, an area I'd love to kind of look at, we've been hearing this phrase, the new normal, has been doing the rounds, obviously. Sarah, coming to you, I mean, is this just now the new normal? Once we're even allowed back to our offices, do you feel there's going to be a little bit more of a relaxed attitude towards allowing people to work from home? I mean, I've even heard some people talking about getting rid of offices altogether because productivity has gone up and costs have gone down. So talk to me a little bit about how you think the new normal will play out and where working remote obviously will play a key role in that.
For my stakeholders, I think it's really been a shift in their perspective. Managers now understand that lots of people have the ability to at least do a significant portion of their work remotely and effectively. Governor Inslee, more than a year ago, had challenged state government to, modernize the workforce, allow teleworking, but there wasn't a lot of buy-in, especially as you got into some of the higher levels of management. And so, for example, my staff, most of them had the ability to work remotely 1 day a week. Now they're going to work 3 or 4 days a week, probably remotely after this. Social workers were never thought of to work remotely. But they're on the phone trying to get placements for patients with discharge. So there's a whole rethinking. I do think that we're still going to come together in person. All the calls I make with my colleagues, they do miss some of that connection, but I think it'll shift quite a bit.
Yeah, I think from our perspective, also on the healthcare side, this is a bit of the new normal, absolutely, Jason. For Clean Slate, what happened was not just the technology, because the technology's always been there, right? It was some of the rules that came down from the federal government allowing telemedicine where they hadn't previously. There are some rules in how we prescribe as an organization. I won't bore everybody in the call with it, but those were relaxed to some degree so that we could perform telemedicine. That was allowed us to then deploy the technology much more than we had in the past. It's allowing us to potentially go into new areas where we don't have bricks and mortar now, because you can do telemedicine right from the first visit. That was a rule you couldn't do before. So it's great because it allows us to, to open up access to more patients who need the care who previously couldn't get it because they are living in an area that maybe is a bit more remote. So I think that is a new normal for that. I think that we still will have a hybrid approach once we're allowed to come back into the healthcare facilities. There will be certain times where people want to come in and see the therapist and the doctors face to face. But I think we're going to be growing in this new normal very much so, and use it as an opportunity, again, to provide more access to care than previously we were able to.
Fantastic. And Diane, coming to you, as we start rounding this out as well, we talk about the alignment of IT in the business a lot. Do you feel the role of IT has now changed and that alignment between IT and business will become even more crucial and critical?
Yeah, so I'll just speak about BHP for a second, because about 3-4 years ago, there was a huge transition in the company strategy, looking to technology really to unlock the value and a lot of latent resources. And so the CIO or CTO function reporting directly to the CEO is a shift I've seen in many industries. I do think there are some industries and companies that see technology only as a cost center and often reporting to the CFO so they can watch budgets and really squeeze down every penny of cost. I think companies that are really going through this transformation and valuing technology have that value proposition, and they're looking for the investments and the return on investments. And so I think the CIO or CTO role now often sitting at the table with all the other senior executives has made a huge impact on how fast technology is being adopted to really change the business value and outcomes. I know it has at BHP.
Amazing. Thank you so much. And final question of the session. I'll come back to you, Amir, as you kicked us off. What main advice do you give to IT leaders to really help accelerate and deepen their remote work strategy, both in the short and the long term?
Yeah, I think, well, even prior to this unfortunate situation, we did see the shift from work from home. We did see, more and more businesses shifting to the cloud because they were able to see the benefits that would derive. What I would suggest is really take a cold, hard look at how things are done, what this has caused you in terms of change to see what's possible. And then, explore, absolutely, focus on, who can actually help you get to where you need to go. The reality is we don't know what the new norm is. Will it be as it was before? Not likely. Will it be as it is today? Not likely. We don't know. And it may differ. I know a lot on the phone today are from various verticals. The one thing I can say about shifting to a cloud platform like RingCentral is we have an open platform. So we have over 200 integrations out of the box. And then we've got a developer community that, over 30,000 developers that are able to customize the solution to your specific vertical, to your specific needs. So as we evolve and come into this new normal, and you shift to the cloud and you look at your digital transformation and your business continuity planning, the good news is it's not one size fit all. You're truly able to deliver the needs of your constituents, your patients, your employees, and your end customers by customizing that solution that means the most and ultimately drives your continued success.
Fantastic. Any last comments from any of the other folks on this panel on that particular subject?
I couldn't agree more, but we'll be giving you a call, Amir, because we're looking for.
All right, well, hey, happy to take that call, and hopefully I'll come visit you. I'd love to get it once things are safe, Paul. I'd love it.
Sounds good.
Fantastic.
Fantastic. Well, thank you all so much for taking the time to join and participate in this discussion today. Obviously, very pertinent topic right now. Thank you all to those who joined to watch this session. This session will be available on demand as well. So for anyone you feel might want to get exposed to this conversation and may benefit their roles in their organizations, please feel free to do so and share that link around. If anyone has any questions or would like to reach out to the folks at RingCentral to talk about how they may be able to help in some of the situations you're encountering right now, then please do feel free to reach out to them also. Thank you all again. Thank you everybody for joining us. From Jason at SINC. See you soon.
Thank you. Pleasure.
Thanks everyone.
Thanks, Jason.